Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you for joining us for Your Health, a program that helps you to stay both informed and healthy. With me today is Caitlin Kirby. She is a public health nurse here in the city of Quincy. Caitlin, welcome back.
Thank you for having me.
Pleasure to have you. Sometimes we bring up topics that have been I guess, in the news recently, and certainly this fits. We've talked about this in the past, but again, we're kind of revisiting it because of its prominence now. Some of the material we cover, just a little bit, might be timely, but the rest of it certainly is information that you could pick up and, I guess, make use of anytime.
Yes, so with this topic, of course, we're seeing it in the news, and day by day we're seeing changes with it. So just with the nature of our show, we'll go more into what is this condition and how do you prevent it, and are you at risk in the general public.
So it is the avian bird flu, or the avian flu. I guess it's known as the bird flu?
Yes, so avian flu, so avian just means bird.
Oh,
actually.
Okay. So if I say avian bird, I'm saying bird twice.
Yeah, so the avian flu is related to birds, as we know. So I'll use that kind of interchangeably, avian flu and bird flu throughout the whole episode.
So I guess the best way to start is by definition. So what is the avian flu?
Yes, so the avian flu is a naturally occurring viral infection that are in wild birds. We actually see it primarily in ducks and geese. And this influenza is caused by an influenza A virus. And these wild birds carry this virus within their respiratory tract and their GI tract, so their intestines. And these wild birds don't get sick from the virus itself, but they can pass it on, because it is very contagious. They can pass it on to domesticated birds such as chickens, ducks, turkeys. And at that point, those domesticated birds can get very sick and die from it. When it comes to humans, there is a risk that it can spread to humans, but typically we would see that virus kind of shift a little bit to become infectious to humans. So it's tough. It's very contagious.
So it's bird to bird right now.
Bird to bird, yes. So it's very infectious bird to bird. Birds to humans are not as much unless you work in a field that you are closely working with wild birds. So we'll get into that.
There are two kinds?
Yeah, so the two main kinds that we see are low pathogenic and high pathogenic. So these low pathogenic viruses, they cause no to only mild symptoms in birds and very rarely cause disease in humans. But if we see this high pathogenic virus, that's when it can have extremely severe symptoms and even death in some birds, particularly poultry. And these high pathogenic viruses are more likely to make humans sick. So it's very important to know what to monitor for and to know your risk.
And I think this is probably the reason why recently egg prices have been high.
Yes, yeah. So we are seeing that it definitely affects that, and it's a lot of scare too, because you see this on the news and you're like, can I get sick from eating an egg? So it's really it's important. I should have started off the episode by saying the CDC and globally, they're monitoring the situation very closely to make sure that the threat to the general public does not increase.
And I suppose there is no current threat, I suppose, with pets or dogs.
So it depends. With the animals, It depends. If your animal's acting sick, maybe I would say check in with the vet. But as far as my research, I more did the poultry and the chickens to humans.
Right. I almost, just like it's not really transferring from bird to human, you don't really hear about it transferring to dogs or cats or any pet. Pet birds always stay in the house because if they'd fly away otherwise.
Yes.
So there's no threat there. But again, it didn't seem like there was any threat for domestic pets.
Not that, no. But I would, if you think you are at high risk and you start to have flu-like symptoms, definitely check in with your provider. And if you once they would probably rule out the situation to see what may be going on. But if you did have animals at home, you could consider at that time reaching out to the vet and seeing if there is any real risk.
Let's look at exposure risks.
Yes. So the exposure risk, the biggest thing is really people who work in the field. So this is our farmers that work directly with chicken or poultry.
Because is it transferable through feces?
Yes,
Okay.
it is, yes. With exposure risk, so the biggest exposure would be exposure to infected or sick or dead animals. So
Which you should never pick up a sick or dead
Yes.
animal, right? You should always call.
Yes. So definitely if you come across a sick or dead animal, do not touch them. You can call animal control in your city to see what the next step is. So that's our biggest thing. You want to avoid contact with dead animals. And then there's also an exposure to surfaces contaminated. So that's more if you, so that's when you think of the secretion. So these animals can spread it from their saliva and also through their GI tract. So their feces does have the active virus. So if you notice that you have a lot of geese in your yard, don't go over it, especially ungloved. Never be picking up the feces. I know working for a health department, we've gotten a call before where somebody had a bird feeder in the backyard that, of course, got bird feces on it, and they had concern thinking they were exposed to the feces on there. And this was like 2 years ago too. It wasn't even. We weren't seeing bird flu in the news as we are now.
Right.
But when in doubt, don't touch it. Don't go near it.
Right, and that might be easy for an adult, I guess, if you have a child, and you do. My child is not a child anymore. He's beyond that age. But the concern is to watch them to make sure that they're not touching.
Yes, especially children, because my daughter is currently 8 months, so she's not moving on her own yet. She's close to that crawling stage, although I do think she'll walk first. But especially when you're outside as the weather gets nicer, if you have a deck and you notice there's bird feces on it, wash it down if you have a power washer, would probably be the best way. And just make sure you're watching your kids, because as you know, kids, their hands go into their mouths at all times.
They explore.
Yeah.
It's kind of an extension of exploring.
Yes.
So let's talk about jobs that people are potentially at risk.
Before we get to the jobs, actually, there is also one more exposure risk. We see eating undercooked poultry, eggs, or consuming unpasteurized milk from infected dairy cows. So really, I will say the CDC is working very closely for testing for these high-risk communities that we'll get into. So they are monitoring like the eggs that are being produced and the milk that is being produced. But I just want to say it's very important to make sure that you are cooking your food thoroughly. And that's always important with eggs and chicken, because even if if you're not trying to get the bird flu eliminated, you also could get a foodborne illness like salmonella.
Right.
So make sure you're cooking thoroughly. And then to walk into those jobs. So the biggest
Farmers,
Yes.
you had mentioned.
biggest exposure risk are people that are working in the industry. So we have our farmers, which would be poultry and dairy and other livestock farmers and workers. Backyard bird flock owners. We have our veterinarians and the vet staff. Animal health responders, so that might be the local animal control officer, because if they're responding to a scene, they're more likely to be exposed. Public health responders, they, of course, because if they're going out for testing and so forth. We have our dairy laboratory workers, our food processing workers, and even slaughterhouses as well. And then you want to think of our zoo workers too, that are out there working with different birds, because you'll see that on the news too right now with the bird flu, is if there's like a sick bird in a zoo somewhere, they're testing for the bird flu to rule it out, to make sure that those employees aren't at risk.
My wife called me, I think as soon as, it wasn't long after the story had hit the news, and Plymouth was one of the areas, Pembroke was one of the areas that had birds that had tested positive.
Yeah.
So she called me and she said, I just ran over a duck in the road. And chances are that bird probably had some kind of illness, whether it was avian flu or something else. And she said, I called the local animal control officer, and you, of course, just listed that worker as
Yes.
one of those that would respond. It's also one of those folks that would have to be careful. Of course, they're trained in how to respond.
Yes, yes. And we'll get into, when we get into prevention, we'll just say some measures that they can take. It's mostly wearing your gloves. If it is a dead bird, make sure you maybe even wear a mask to keep yourself safe, and then monitoring for symptoms. So it's really good to know that the general public is not totally at risk for this. At this moment, it's really confined to these workers that are working closely with
And
these
again,
animals.
it primarily transitions from animal to animal.
Yes, yes.
Let's talk about signs and symptoms.
Yeah, so the reported signs and symptoms of the bird flu in humans have ranged from no symptoms to mild symptoms. But then there is also moderate to severe disease complications resulting. So some mild symptoms people may have is conjunctivitis,
Red eyes.
and that is actually the predominant symptom that has been among U.S. cases. You may also see mild fever, sore throat, cough, runny or stuffy nose, muscle or body aches, and fatigue. And then, while the current public health risk is low, the CDC is watching the situation very closely, I want to say. Moderate to severe. We have high fever, shortness of breath, difficulty breathing, and altered states of consciousness, and even seizures. So
Right, because it can be fatal.
can get very extreme. So typically, and as you will notice, a lot of the symptoms, they can mimic like it can mimic COVID, it can mimic your basic flu. So if you develop these symptoms and you have livestock that you take care of, I know I have cousins out in Bridgewater and Easton, and they have, I think, 24 chickens each.
Right, because there's space out there.
Yeah. So they have the space, they love it, and they're out there all day with their chickens. They all have a name and a personality.
Of course they do.
Yeah. But but like if one of them were to get sick with flu-like symptoms, they're at higher risk than I am.
Sure.
Whereas I am not dealing with livestock at all. So it's just important to know your risk and just know if you were to develop these symptoms, make sure you're telling your doctor and follow up. Because right now it's very easy. And I feel like we've all done it probably our whole lives, even before COVID was a thing, is when you get a cold or cold-like symptoms, we're so quick, and our lives are so busy that we're so quick to say, oh, it's just allergies.
Absolutely.
And you just go about your life, which is understandable because you have to go about life. You only have a certain amount of sick days off work and so forth. But if you are feeling sick, especially if you have an exposure risk, check in with your doctor. And if you cannot miss work, put a mask on and be safe, just because you don't want to get others sick around.
Correct. And that goes for any
Any
illness.
respiratory illness,
Right.
yes.
Let's talk about prevention, because if you can prevent it in the first place, that's the goal.
Yes. So our biggest and best way of prevention, of course, is avoiding the source of exposure, which sounds silly, but again, that's avoiding any sick or dead birds. That includes poultry and other animals too. Keep your distance. And then if you do have to have direct contact, with a dead or wild bird, poultry, or other animals, including dairy cows, wear the recommended personal protective equipment. So these may be gowns, gloves. As your average citizen, there's no reason you have to pick up a dead bird.
Absolutely.
Call your health department, call your animal control, get some advice before you do anything. Because you never know. We had a dead possum in our backyard and we were advised to just throw it out. I'm like, oh, okay. I'm like, all right. You wouldn't think that would be the answer.
No, I suppose use a shovel. Don't touch.
Yeah, don't touch it.
Go ahead.
We were advised measures to not touch it and
Right.
like put it in a garbage bag and throw it out. But that is, again, I wouldn't know what to do with that, so we called the health department to ask.
That actually gets me to think about sanitation. And okay, let's say you didn't call the health department and you used a shovel for either a bird or a possum. I suppose maybe disinfect that after.
Yes, because then you would think of the cross-contamination. Like if you, you think of that with anything, like shoes especially, like you're walking around all day and
You have a baby that's about to crawl.
yeah. So when I walk around the city and then I walk back into my home, if I'm wearing the sneakers, all the viruses and dirt and everything on the bottom of my sneakers is then getting on my floors.
Because people don't think of how long a virus will live on, let's say, the bottom of your shoes.
Yes. So it's and especially with young children, again, Hannah's about to crawl. So it's top of your mind, but you want to think that for everything. Like if you are walking around your house barefoot after wearing your shoes and then you're jumping into bed, those viruses are then going into your bed with you.
Right.
So take your shoes off at the door and that way. And a lot of times have indoor shoes. Like I always put slippers right on and that way I don't feel that I'm not wearing shoes around.
Correct.
So,
Correct.
yeah.
We talked about you touched upon food preparation.
Yeah, so food preparation. So we want to think of the way these eggs and poultry, you have to make sure that it is heated to a certain internal temperature to kill the bacteria and viruses. So with chicken, you want to make sure that the internal temperature is at least 165 degrees Fahrenheit.
And we should mention to folks, because I have one, though sometimes you don't think of using it, there are poultry meat thermometers that you can use, put directly into what you're cooking, and that will give you the temperature at that moment.
Yes. Yeah, so the best way is to have a meat thermometer. So I definitely recommend having that in your home if meat is something that you cook often.
No poultry.
Or poultry. And then also with our eggs, we want to cook those until the yolks or the white is firm. And for egg dishes that do not contain any meat or poultry, they have to have an internal temperature of 160 degrees. And then if there is meat and poultry in that egg dish, it has to be 165 degrees. I do want to say, you can look this up. It's called Check Safer Food Choices, and it's on the CDC website, cdc.gov. And if you go to that link, they have basically every food item you can buy, and it tells you how to cook it properly. And that also gives the recommendation, too, that you would think of with this current situation with the bird flu, is our consuming raw milk and unpasteurized milk. It's really not recommended because of the safety, especially right now where we're seeing the bird flu in some of our cows. Again, it is being monitored.
I'm glad you brought that up because, yes, cows were found to have the flu.
Yes, so they are found. So we are seeing the cows can even spread it to the humans as well. So just make sure that when you are picking milk products, try to go for the pasteurized milk. It's the safest way to go about it.
Very good. Anything I missed or anything you would like to add?
So I just want to say, so this was my first episode back after having my daughter. So
That's
I was
right.
a little all over the place. So if there are any questions,
I'm always
people
all
can-
over the place.
people can reach out to
I
me.
totally understand your
Yeah.
line of thought.
But I want to say, so all of the information that I obtained on this issue is from the CDC, the Center for Disease Control and Prevention. And if you go to that website, which is cdc.gov, under bird flu, they have an interactive map, basically, of what they're doing. So how many tests they're giving out, how many groups of poultry they're testing, cows they're testing. So it's very interactive, and it tells you all the maps of where we are seeing cases. At this very moment, Massachusetts is not on the map for human cases. But I thought that was a great website, and especially for viewers at home, if you're watching this and it's months out from now, you could go on that CDC website to see what is currently happening with the bird flu at this moment.
And something we didn't mention, and it's important. It's not only important for the bird flu, but any illness, and that's the importance of washing your hands with soap and water anytime you're given the opportunity.
Yes. So that should have been, I'm sure that was under my prevention. I just skipped it. But
As did I.
that's the biggest thing is if you are outdoors doing yard work, when you come in, wash your hands. Make it a habit to always wash your hands, because even touching your front doorknob, you don't know how many times you've walked in and out of there not knowing what you're touching. So you don't know the viruses and bacteria on your hands. Always wash them, and it's the best way to keep yourself safe.
Right. And in the event that you don't have soap and water at your readiness, those hand sanitizers are
Yes.
good. They're good at least temporarily.
Yes, they're good for the moment, but the best way is always soap and warm water. And you want to sing 2 counts of Happy Birthday.
That's right.
To make sure you're really getting underneath your fingers and between them. And it's also important to know, too, I can get, if you wear jewelry, those viruses and bacteria can hide in your jewelry, too. So make sure you're scrubbing that as well.
And I think most folks, especially children, don't tend to wash their hands, I guess, the correct time or the correct Yeah, time.
The length of
They're
time,
not
yeah.
the length of time. They're not singing happy birthday twice.
Yeah, and that's kind of where you get the happy birthday, or you can do the alphabet song, and that's a fun way, especially if you have young children at home or grandchildren. It's a fun way to teach them, and they'll actually want to do it because they're singing and having fun.
Right, right. And that's what it's all about. And the hand
Yeah.
sanitizers, just one last note, the hand sanitizers basically just make, I guess, the surface of your hand less pleasing, less attractive to germs.
Yes, it can kill some of the bacteria, but it's not as strong against the viruses.
Okay.
So there is protection, but I'd still say if you're eating a meal or something, like after Purell, don't be, or any hand sanitizer,
Sure.
don't be, it's not the safest to be eating after that because you're
Right.
not killing all those viruses.
Okay,
So
so
the
if you have
best,
to-
soap and water.
Soap and water.
as
And
soon
I
as
suppose if you
can.
are eating and you don't have soap and water, maybe whatever packaging the food
Yeah.
is in, use that as opposed to putting your hand directly onto the food. Okay.
I think with all bacteria and viruses, we're just a lot more aware now as a society because of what we just went through with the pandemic.
Sure.
So we're a little bit more aware of how to keep ourselves safe.
That's a good thing.
Yeah.
All right, Caitlin, thank you for joining me. Thanks for coming back. And obviously, taking time for your daughter was important. And
Yeah.
Congratulations
Thank you.
to your recent addition. And we'll speak in the future.
Yes, thank you so much.
Thank you. And thank you at home for watching. You've been watching a program of Quincy Access Television. And just remember that to support Access TV in the community in which you reside. Thank you.